any pregnancy is a normal pregnancy till there is some complication that we pick up in that, which could affect either the mother or the baby or both outcome wise. So there are various factors which can give us an idea or a hint that this pregnancy can become a high risk pregnancy.
Good old days, the marriages used to happen in 20s. These days, the marriageable age has moved to 30s plus. In fact, many marriages that take place is between 32 and 35. Then probably 1 or 2 years people want to enjoy, and then they start thinking of planning the family. So with that, the deliveries have become tricky, and IVF, high risk pregnancies are more common, and people need such things. So to discuss about this, we have invited Dr. Amol Gadgil, who is a gynecologist, has more than 30 years of experience. He has extensively worked in India and in Africa. Welcome Dr. Amol Gadgil on the 9th episode of Arogyamkatta. Before we start, can you tell us what's a high-risk pregnancy?
First up, thank you, Mr. Gadgil, for having me on the show, and thanks for those kind words. Any pregnancy is a normal pregnancy till there is some complication that we pick up in that, which could affect either the mother or the baby or both outcome wise. So there are various factors which can give us an idea or a hint that this pregnancy can become a high risk pregnancy. For example, a mother having a history of repeated miscarriages, a history of late pregnancy, or a woman who's becoming pregnant in adolescent or teens, or a woman who is diabetic, or a woman who has got twin pregnancy, and so forth. So high risk pregnancy can in a sense be termed as a pregnancy which can potentially give a complication or result in a complication and morbidity and or mortality to the mother or the baby or both, and we need to be careful in picking these up.
I see. Now, does age and lifestyle contribute to the degree of risk?
There are certain predisposing factors, as we say, or certain factors which should up your antennae when you are dealing with a pregnant woman. A woman who has become pregnant, a girl who has become pregnant very early in her reproductive age, that is in her teens or adolescent years, as we say, because the woman has not developed, she has not developed bodily into a complete adult. So her body may not be ready to accept and continue with the pregnancy. This is one end of a reproductive age, and the second end of the reproductive age is 35 plus, when there are other complicating factors which may have a role as the pregnancy advances, like the mother could be pre-diabetic and become diabetic during pregnancy, as we call it gestational diabetes, or these women are more inclined or predisposed to getting high blood pressure during pregnancy. So those pregnancy can be categorized at the either end of the reproductive age spectrum as high risk pregnancies. Secondly, when it goes to lifestyle, there are certain lifestyle diseases, as they say, like hypertension, which can complicate a pregnancy. Certain ways of life, like smoking or alcohol consumption. There is no such thing as moderate alcohol consumption in a woman who is pregnant. She has to cease that. So such things like smoking or alcohol which can have their own effects on the baby as well as the mother, are potentially high risk pregnancies.
At what stage of pregnancy you get to know it's a difficult case or it's a complicated or it's a high risk category?
Typically, a woman, there are certain, like I said, pre-existing factors which can give you an inkling that this woman can have a high-risk pregnancy going forward through her pregnancy, which could be high blood pressure, pre-existing high blood pressure, which could be pre-existing diabetes, which could be pre-existing thyroid disorders and such. Of course, in early pregnancy, if we pick up something like twins or triplets, so multiple gestations as we say, or in certain races, let us say in sub-Saharan Africa, where I have worked for some time, the incidence of high blood pressure in pregnancy is more as a race, or incidence of fibroids complicating pregnancy is much more, because those women tend to have fibroid of the uterus much more frequently than Asians. So when we take a patient's history, we come to know that okay, this lady is likely to have or her pregnancy needs to be monitored very closely as we go forward in the pregnancy. And so we have to closely monitor those. And secondly, women who are what we call as primees or elderly primees, those beyond 30s and becoming pregnant for the first time, particularly beyond 35, there we know that okay, this woman needs to be monitored closely. And so sometimes they are normal as they start the pregnancy, but very early in the pregnancy, or say around 20 weeks or so, we can or even before that, we can pick up that okay, they are developing abnormal sugar levels, as we call gestational diabetes, or they are developing high blood pressure. Now, the causes of high blood pressure can be multifold. Like I said, elderly primees tend to have that, or diabetic mothers, or women who have had other familial history. So those things we tend to pick up early, and multiple gestation, I think I mentioned just now. So those things are likely to, those women are likely to have high risk pregnancy. So we have to catch them as early as possible, catch any signs, symptoms, or any abnormal investigations which can tell us that okay, this lady is going into a high risk category.
Now, suppose somebody changes their lifestyle after knowing that she is pregnant. Would this reduce the chances of complications?
That would reduce chances of complications, yes. But the best way is to cease doing the wrong lifestyle stories before the woman conceives. Okay. Let us say the woman and the man both, now this is very important, the woman and the man both have to quit smoking, have to quit alcohol, because both these can affect the quality of sperm, and that again can have a problem to the
impact on the
the baby genetically. Then if a mother continues with alcohol, even in small quantities, sometimes the baby can have something called as fetal alcohol syndrome.
Okay.
So these are known things, and so the best time to quit these lifestyle things is to quit them before the woman becomes pregnant. So you are really reducing chances greatly. Okay, but even then, even after she knows that yes, she has become pregnant and she quits, still she is reducing the chances of any harm to the
whatever damage that has occurred could have been there.
Yeah, to the baby or to herself.
To herself. Okay, now you must be handling difficult cases day in, day out, and a lot of negativity around, because sometimes there would be a death of the fetus or the bachus or the mother or whatever. How do you, as a doctor, I know the ambience which is outside the delivery room or the operation theatre, all the family members gathered with a lot of anxiety and a lot of tension. How is the ambience inside the operation theatre amongst the doctors and the people who are present inside?
typically everybody is quite serious about the job. So it's and they are extremely focused. Each and every of the medical team, each and every person of the medical team who is involved in the delivery, in the parturient as well as the baby, is very dead serious and focused on the job, because they have to be. No matter what the situation, they have to tackle the situation to salvage the mother and the baby's life, and as far as possible make the mortality chance zero, and morbidity chances also should be less or zero. This, we are talking about a pregnancy which is already complicated. A pregnancy which is not complicated, well, we are supposed to be giving
Much relaxed.
working in a much relaxed atmosphere, and supposed to be giving a good outcome at the end of the story.
Does the family has a role to play in the pregnancy? Does it have any impact on the
Family has a big role to play. In a way, they are the support system. They are the ones who are supposed to take care of the diet, of the exercise routine, of whatever medications the woman has been advised. Plus, they have to keep the family, the household ambience peaceful and quiet. This particularly is imperative in women who are having a borderline high blood pressure or something, because anything which is not conducive to a quiet atmosphere, which is a very loud and shrill situation somewhere, can suddenly trigger a shoot up of blood pressure, and very occasionally it can also lead to the mother throwing a convulsion. So, and these things are, I cannot say prevent, but we can at least reduce the chances of such a tragic occurrence happening by just keeping the home ambience at a peace, at a reasonable, volumes are low. Everything around the woman should be preferably in a happy and a pleasant way, be conducted in a happy and a pleasant way. And yes, as I said, essentially we have to take care of her psychology. The family has to take care of her psychology, has to take care of her health, and has to take care of her fitness in general. So these things will go a long way in preventing an occurrence of a high risk situation in a woman, let us say high blood pressure, or in a woman who already is having some kind of a predisposing thing. The chances can go down. Let us say a woman who is having twins or triplets, particularly after a IVF pregnancy, or a woman who is elderly and become pregnant for the first time, or a woman who is a diabetic, or who has been diagnosed with gestational diabetes or a thyroid disorder or something, for which she is under medication or some sort of a treatment. And so those things can be comfortably kept under control by medication, of course, but a healthy family atmosphere goes a long way in precipitating a complication. Let us put it that way.
So just out of curiosity, I'm asking. Normally it's said that Indian baby bachus weigh around 5 to 6 kgs or 4 to 6 kgs. How much does African babies weigh?
I think you're talking about pounds, not kgs.
Oh, sorry, pounds.
Anyways, yes, African babies do weigh more. In fact, the biggest baby weight that I have delivered is 5 kilos.
Wow.
I have delivered a 5 kilo baby. Of course, the mother was big. She was about 140 kilos.
Oh.
So the baby was bound to be that. But yes, in general, African babies tend to be bigger. Let us say 3 kilo plus, but not always. Quite a few of them are actually underweight because the mothers are malnourished.
Okay.
The reason is, we have a feeling that African babies will always be
be hefty,
big and
probably.
hefty. Yes, that is true to some extent. But there is a big number of African babies which are actually underweight, and that is because, of course, some African races tend to have smallish mothers, rather their body frame is smallish.
Okay.
So the baby will be small, and again they also have dietary challenges. Their nutrition may be really bad, and then access to healthcare may not be as good as we see in Indian cities, particularly in Indian cities, I would say. Yeah. So
Can you narrate one pleasant experience during your 30 years of practice?
well, I had a mother. We are talking about a high risk pregnancy. I guess.
I mean, some pleasant.
Yeah. And the family was very anxious because the pregnancy had happened after some 15 or 16 years of infertility, and as luck would have it, they had taken some basic fertility medication with me, and they had conceived. So now all the more like a moral responsibility and all the pressures on me as to doc. Now this is your baby sauce, and that mother developed hypertension during pregnancy. She did, and okay, fortunately we could cover her. And at the end of it, she delivered a healthy baby through a cesarean. And the baby was good sized, and the baby was about 3.4 kilos or something. And the family was really happy because in that particular family, it was a baby girl, and that particular family, they were very delighted to have a baby girl because everybody else in the family had a boy. So this was the only daughter, and they were really happy with that. So yes, that was one pleasant experience. There are many,
of course.
but this is one which comes at the top of the hat, as they say.
Good old days, they used to say that you should hang a healthy baby's photo in the room. Probably Murphy calendar, if you remember, Murphy baby was probably the most popular one amongst Indians.
Correct.
Now, does it have any relevance in the pregnancy or any impact on it?
It has relevance in the way of assuaging the mother's anxieties and giving her a positive vibe psychologically. It does have. But this particularly becomes true in case of a woman who has become pregnant for the first time, because she is really, really unsure as to how to handle the pregnancy, and after she delivers, how to handle the baby. So her concerns need to be addressed, and whenever she is passing through the house and she sees such good pictures, of healthy babies and so, she feels okay. She can relate to it, saying that okay, I'm at the end of it, I'm going to have a baby
like this.
So that gives her that positive impetus to keep on the track and possibly later handle the baby situation properly. Because many of these first-time mothers, why this becomes important? Many of these first-time mothers, after delivery, they just don't know how to handle a baby. So if they do not know how to handle a baby, they land up with a postpartum psychosis and severe depression, wherein they actually end up needing a psychiatric help.
I see, okay.
So these things can be largely avoided by having such good photos and posters. Yes.
We all have heard the story of Abhimanyu. He used to hear what the mother was talking, and probably Garbha Sanskar generated or that came because of that. Does it have any relevance? Is it true, or does the babies react to some sounds or some waves outside?
Babies, it has been documented. Babies do react to some sounds and waves. Yes, it has been documented. But do they understand? Do they relate to it? Do they imbibe whatever or grasp whatever is being put across? Well, I have not come across any study. When I say study, I mean any study which really documents and confirms a finding that such prenatal education sort of is imbibed by the baby. Because you need multi-center double-blind control studies to to actually prove or disprove this. So there is no.
So it's not completely humbug, neither it's scientific.
Let me put it
But
this way. It is. I cannot strictly call it scientific,
okay.
but there could be some iota of truth in it, in the sense that, like I said, babies do respond to music, they do respond to sound. So there could be a grain of truth, but to the extent of Abhimanyu, well, I think that would be stretching it.
Okay. Thank you for answering all the questions. We will ask you some rapid fire round questions, and the answers will be yes or no, or very briefly. I mean, there is no long answer expected.
Yeah, I get that.
Thank you for coming to Arogyamkatta, and we look forward that we'll have many more episodes from you.
Yes, thank you very much for that.
Doctor, I'll ask you some rapid fire round questions. Is 35 always a high risk?
Not necessarily, but has to be monitored closely.
Diabetic patients need not be high risk cases.
No, they have to be considered high risk.
Bed rest is necessary for all high risk patients.
Some of them, not all.
Twins are always high risk.
They are always to be monitored closely, not always high risk.
Smoking causes high risk pregnancy.
Yes,
High risk patients can do exercise.
yes,
Junk food can be eaten during the pregnancy.
no,
Stress alone can cause high risk.
yes,
Flying is safe in after 8 months of pregnancy.
no.
Previous miscarriage affect future risk.
It does increase future risk.
Weekly monitoring is necessary for all high risk patients.
Some of them, not all of them.
Thank you very much.
Thanks for having me on the show.
If you liked the video, please subscribe to our YouTube channel, Arogyamkatta, where we bring you insightful interviews with doctors from various specialties. Stay tuned for expert advice and valuable health information.